It's important to enroll diverse patient populations in clinical research in order to enhance the likelihood of generalizable findings. Certain patient characteristics are known to be associated with research participation, including age, race, and gender. However, very little research has examined the effect of patients' health literacy levels on their likelihood of participating in clinical research studies. Health literacy affects patients' ability to understand and act on information, and this includes research information. We conducted a study at Vanderbilt University Hospital in Nashville, Tennessee, where we have screened patients' health literacy levels since 2010. As part of the enrollment process for a large cohort study, we were able to combine information about patient recruitment and consent with the hospital's health literacy data. I'm Sunil Kripalani. I'm a professor of medicine at Vanderbilt University Medical Center, where I direct the Center for Health Services Research and the Center for Clinical Quality and Implementation Research. I'm excited to tell you about our research study in the Mayo Clinic Proceedings, titled Disparities in Research Participation by Level of Health Literacy. We examined the effect of health literacy controlling for sociodemographic characteristics. What we found is that patients with low health literacy were less likely to be willing to hear about a research study. They were also less likely to enroll in the study after going through the informed consent process. These effects existed after adjusting for sociodemographic characteristics. They also existed in spite of following best practices for research enrollment, including giving information in plain language, giving patients ample opportunity to ask questions, and using teach-back to help confirm understanding. Our findings show that additional strategies will be needed to help engage patients with low health literacy in clinical research. What are the implications of this study for patients? If you're a patient considering participation in a clinical research study, please feel free to ask as many questions as you want. If something in the research information doesn't make sense or doesn't add up, ask to speak to the research team again. Discuss it with your healthcare professional or another member of your trusted community. The important thing is that you have enough information to feel like you've made an informed decision about whether or not to participate. One of the implications of this study for clinical research and practice is that we need new, more effective ways of engaging patients with low health literacy in clinical research. Of course, we should continue to offer information in plain language, provide ample opportunity for questions, and also use the teach-back technique. However, we should test different strategies as well, such as referring patients to studies through trusted information sources. They might be more interested and willing to hear about a study if information comes from a trusted source, whether that be the patient's healthcare provider or a trusted friend or family member, or someone in their community. We should also test new ways of communicating information with patients who might be concerned about the literacy-related demands of a study. For example, if a study has questionnaires, it's important to clearly explain to patients what are the procedures in place so that they could participate in the study through an interview process involving verbal communication, so they don't have to deal with the literacy demands of long questionnaires. There are additional approaches which may be necessary, and we should continue to test different strategies to help close this gap and disparity in research participation.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.